अस्सलाम वालेकुम, वेलकम टू माय चैनल डॉक्टर शामी सेज। तो आज से मैं एसके सीरीज़ की रैपिड रिकॉल वीडियो स्टार्ट करने जा रहा हूँ। इन वीडियोस में डिटेल्ड एक्सप्लेनेशन नहीं होगी एमसीक्यूज़ की, जस्ट एक क्विक रिवीजन होगी। इन वीडियोस को आप बार बार रिकॉल एमसीक्यूज़ को करने के लिए यूज़ कर सकते हैं। तो डू सब्सक्राइब माई चैनल। लेट्स स्टार्ट। सो मैं स्टार्ट ले रहा हूँ SK16 सर्जरी 22 फरवरी मॉर्निंग पेपर से। क्वेश्चन नंबर 1, फोनेशन अकर्स ड्यू टू अल्फा वाइब्रेशन ऑफ वोकल कॉर्ड्स। Second, deep plantar artery is the branch of E. dorsalis pedis. Third, a patient with acute appendicitis, pain and the fever for the last 24 hours in the pathological examination seen inflammation, that is alpha neutrophils in the muscular wall. 4, veins accompanying left circumflex arteries, which of the following, that is beta anterior cardiac vein. Fifth, a patient presented with the sore throat and membrane covering the throat. Upon removal of the membrane it bleeds, so it is most likely the diphtheria. Question number 6, in HIV patient surgery done, which antiseptic is used to clear the floor after the surgery, that is 1% hypochlorite. आप इसे ऐसे याद रख सकते हैं कि फ्लोर सिंगल होता है तो 1% और इंस्ट्रूमेंट मल्टीपल हैं तो उससे 2% ग्लूटाराल्डिहाइड, ये इस तरह आप इसे रटाफाई कर सकते हैं। 7, a sprained ankle resulting from excessive eversion most likely demonstrate which structure is damaged, that is beta deltoid ligament. Next, 8, history of the trauma to the scrotum, anterior abdominal swelling and the rupture of D. spongy urethra. 9, external anal sphincter is supplied by the pudendal nerve. 10, the therapeutic index of the drug indicates beta safety. 11, 22-year-old primary gravida has noted no fetal movements at 18 weeks gestation. Fetal ultrasound examination shows marked hydrops fatalis and organomegaly. There is extensive cerebral necrosis in the periventricular calcification. Infection with which of the following organisms is most likely to produce these findings, that is beta cytomegalovirus. 12, pregnant lady has no complaints but mild cervical lymphadenopathy in the first trimester. She was prescribed spiramycin but she was non-compliant. Baby was born with hydrocephalus and intracerebral calcification. Which of the following is likely cause, that is toxoplasmosis. 13, a lady with postmenopausal osteoporosis, history of breast CA in the family. Which drug to be given, that is E-SERM. 14, a patient presented with the painful right big toe. He was diagnosed to have gout and doctor advised him allopurinol. Which factor will affect the availability of allopurinol, that is albumin beta. 15, infection mononucleosis is caused by the Burkitt's Epstein-Barr virus. Which of the following will prove this association, that is beta produce toxin against the DNA. 16, a female was diagnosed with the pulmonary TB. She has been taking OCP for the 2 years. She suddenly started vomiting. Her beta HCG came positive. Which of the following drug has caused the OCP failure, that is rifampicin. Next, 17, basal ganglia send excitatory output to Charlie medullary reticular system. 18, level of the LH peak how many hours before the ovulation, that is 24 hours. 19, regarding two-tail test B, that is beta equal chance of rejection on the both sides. 20, the porphyrins attached to which in the plasma, that is the albumin. 21, the content most likely to be seen in the inguinal canal of the female is round ligament in the ilioinguinal nerve. 22, the COVID-19 recently shows a species transfer which is named as the SARS-CoV-2 beta. Next, 23, the nerve supply of the rectus abdominis, that is the lower 6 thoracic nerves. 24, what is the location of the compact bone, that is the directly under periosteum. 25, which when the carbon dioxide transfer to lungs from tissues, what happens, that is acidosis of the RBCs. 26, infectivity of the streptococcal pneumonia is due to the beta streptolysin. 27, cell wall of the gram positive cause septic shock. Which component of cell wall caused the shock, that is the peptidoglycan. Next, the 28, after hypophysectomy which cells will be affected, that is the follicular cells of thyroid. 29, maximum number of the beta cells in islets of Langerhans are present in the tail of the pancreas, beta. 30, centrum and the neural arc is in the vertebra is joined by the Charlie, that is the pedicle. 31, the condenser lens in light microscope concentrate the light into cone light into the specimen. 32, the sparse pubic hair is in which stage, that is the stage 2. Regarding zone of fasciculata of adrenal glands, ACTH act to produce the corticosteroid. 34, during inspiration the muscle which increase the transverse diameter of the thorax is beta external intercostal. 35, the deep inguinal ring is formed by which of the following, that is the fascia transversalis. 36, breast of adult female lies over superior pectoral fascia. 37, most common complication of diabetic mellitus is dry gangrene. 38, sedimentation of erythrocyte increase by decrease In the albumin 39, a child presented with recurrent rhinitis, urticaria, and the rash. No on the lower limb. What is the cause? That is the type 1 hypersensitivity. 40, effect of the hypernatremia on the body is beta, the cell shrinkage. 41, a 41-year-old girl presented with the primary amenorrhea, short stature, shield chest, and the wide carrying angle causes basically primary amenorrhea associated with the Turner syndrome. 42, the pregnant female had decreased level of T3, T4, and increased TSH. Lymphocytes are also found. It is related to the Hashimoto's thyroiditis. 43, similarity between the cardiac and the skeletal muscle is the transfer saturations. 44, in hanging, sudden death occurred with the fracture of the odontoid process of axis. 45, a non-diabetic female underwent cholecystectomy, presented on the 4th post-op day with the cuff hemoptysis and the dyspnea. She has developed the pulmonary embolism. Charlie, 46-year-old female, fall in the washroom led to the fracture replaced by prosthesis. On falling day, she developed dyspnea and petechia on the skin. Cause is which of the falling? That is basically the fat embolism because of the fracture of some sort of bone. Next, 47, length of the left bronchus is 5 centimeter and right bronchus is 2.5 centimeter. 48, the patient of TB is on ATT for the 2 months. TB antibiotics characteristic is Charlie cell bound. 49, complete transaction of the brainstem above the pons would prevent any voluntary holding of the breath. 50, after hemorrhage, what is immediate mechanism to stop the breathing? That is the vasoconstriction. Next, 51, the receptors for the growth hormones are present in which part? That is plasma membrane. Next, 52, the ribosome complication is beta RNA plus proteins. 53, the patient has anemia and hypersegmented nuclei due to the deficiency of Charlie folate. 54, how is iron deficiency in the serum checked? That's the level of the ferret in Charlie. 55, a female came with her son who presented with one testicle absent. On examination found right test is normal and the swelling in the left inguinal region. What is the risk? There will be the risk of malignancy. Which factor regulate 1,2,5 dihydroxycholecalciferol? 56, that is calcium level Charlie. Prothrombin time is used for jaundice. 58, the riboflavin combined with phosphate to form 58, that is Charlie. 59, a boy presented with the breathing difficulties and intubation was done. Laryngotracheobronchitis is the cause. It is caused by H. influenza. 60, 55-year-old man with the painless testicular swelling and LDH raised. What is your diagnosis? That is the lymphoma. Next, 61, a baby delivered at 32 weeks now have respiratory distress for lung maturity. Which drug could be given? That is steroid, which is betamethasone. 62, skin cancer most commonly associated with the AIDS is the alpha, that is Kaposi sarcoma. 63, the vessel at the base of the bladder lies in which ligament? That is dorsolateral ligament. 64, 6-year-old child presented with the weakness, lethargy, MCV 59 and HB 6.8, that is iron deficiency anemia. 65, hypospadias is due to the abnormality of the urogenital folds, beta. 66, study involved to rule out the cause of the rare disease is the case control study. Next, 67, in median episiotomy, perineal body is damaged. If the perineal body cut, which muscle will be damaged? The bulbous spongiosis and the superficial transverse perineal. Next, 68, which of the following is released at the synapse between incoming PAN fibers and the PAN inhibitory fibers in the CNS spinal cord? That is enkephalin delta. The patient is taking warfarin and starting to bleed. Which is the treatment of it? Vitamin K and the FFP. Long term is vitamin K and the immediate treatment is PCC or FFPs. 70, a girl during menstruation develops high grade fever but she uses tampons. Organism responsible is Staph aureus. 71, the female presented with the colicky flower likely in the perineum and diagnosis of the condyloma acuminatum was made, and this is caused by the HPV Charlie. 72, the female 17-year-old with the primary amenorrhea, absent secondary sexual characters. On examination, well-developed normal breast and the blind vagina. Ultrasound confirm absent of uterus. Most likely karyotype of this would be the testicular feminization beta. Early diagnosis of the preeclampsia is done by the early BP monitoring. 74, which is the preeclampsia triggering factor? That is the fetal endothelial dysfunction. 75, how many days does it take for the spermatozoa to form the mature sperms? That's the 75 days. 76, a female with a menstrual cycle 21-23 day cycle, when will the ovulation take place? It will take place in 7 to 9 days in this particular scenario. 77, a male with a long standing history of the hypertension died. On autopsy, his heart was found to be 600 gram. Reason of his increased heart rate is hypertrophy. 78, a patient after blood transfusion had hemolysis. Which factor will have the decreased level to the binding with the hemoglobin, that is the heptoglobin. 79, which cells are responsible for the formation of the pyogenic abscess, that is neutrophils. E. 80, rachnoid pia dura merge to form the coccygeal ligament at which level, that is S2 beta. 81, ADH level decrease by increased plasma volume delta. 82, population of the true negative among all those who are actually true active, that is the negative predictive value. 83, anesthetic with decreased blood flow to the liver is halothane. Next, 84, which of the following is the parasympathetic effect, that is erection of the penis. 86, which of the following is an autosomal dominant disorder with tumor mutation, that is familial adenomatous polyposis. 87, a procedure which most organism but not spores, which organism spores are more resistant, that is the clostridial spores are more resistant. Charlie, beta hCG is detected in the urine at 14 days. Ureter is derived from the mesoderm. 89, then 90, progesterone is the precursor of alpha aldosterone, cortisol and the corticosterone. Next, 91, the roof of anterior horn of the lateral ventricle is formed by the body of the corpus callosum. 92, the baby has some cardiac abnormality, she has machinery murmur, and the machinery murmur is of PDA, patent ductus arteriosus. 93, the patient was diagnosed to have the gout. Which of the following enzyme could be targeted by the allopurinol for the treatment of this patient? Allopurinol targets xanthine oxidase E. The 94, endometrium consists of the glands and tortuous arteries and is edematous during the late secretory phase alpha. 95, the pyruvate is intermediate between the glucose and acetyl CoA. 95, 96, nerve supply of the obturator internus is from the sacral plexus. 97, right ovarian vein drains into the inferior vena cava. 98, lymphatic drainage of the skin around the anus is from the medial group of the superficial inguinal lymph node. Charlie. Next, 99, the factor 9 is replaced by FFP. 9 FFP, basically you can remember it as 100, new antihypertensive drug going to test investigate by which technique, that is a sequential trial. 101, main sport of uterus is the transverse cervical ligament. 102, about iron absorption from gut, what is correct? Dietary iron is more readily absorbed, that's alpha. 103, which branch of renal artery supplies the network around the glomerulus, that is the interlobular. 104, the chromosome align at the equatorial phase plate in which phase of cell cycle, that is the metaphase. Charlie. Next, 105, myelination of CNS is by the oligodendrocytes. 106, if myelination of axon damage, what will happen? Increase resistance in noded and the internodes. 107, the true regarding the sweat glands, the tubular structure. 108, vitamin C function is the hydroxylation of the proline and lysine residues beta. 109, in order to avoid complication during the procedure remains in the limit of the professional competence. 110, the true about the alpha motor neuron is myelinated. 111, 68-year-old woman with the uterine carcinoma undergoes a surgical resection. The cancer can spread directly to the labia majora in lymphatic that follow which of the following structure, that is round ligament of the uterus. 112, which of the following is true regarding the normal distribution curve? Alpha has central convex peak with the concave tail. 113, the enzyme involved in the cell remodeling of the tissues is beta, that is collagenase. 114, the patient after eating from the restaurant in dinner then at the midnight present with abdominal pain, vomiting and the diarrhea due to the Staph aureus. 115, the valence of Staph aureus strain is measured by agulase positivity. 116, most important test clinically for the tumors is which of the following, that is staging. 117, the patient presented in the ER with B string, what will be raised? That is going to be IgE. 118, the right-sided paralysis and the loss of vibration tongue deviated to the left lesion is in the medial part of the medulla. 119, the congenital erythropoietic porphyria, which enzyme will be deficient? porphyrinogen 3 120, which drug has the maximum first pass metabolism by the oral route, that is the nitroglycerin 1 to 1. A normal neonatal heart rate is 110 to 150. Charlie 122. Negative stretch reflexes by the Golgi tendon 123. At birth, a baby girl has a meconium in her vagina and no anal opening. Which type of the birth defect does she have? That is Charlie imperfect anus with the recto vaginal fistula. 124. Cell arrive in the diplotin. What is the phase? That is the prophase. To 125, the patient has the excruciating right leg pain. Anterolateral right leg cordotomy was performed. Which tract was involved in this case? That is the left lateral spinothalamic tract. 126. Regarding hemoglobin, true is act as a buffer as it accepts the hydrogen 127. A band is in the sarcomere consists of delta, that is a myosin and some actin. 128. Left lower lobe lung differs from the right upper lobe lung but not having Charlie apical portion. 129. Young patient, known atopic, having urticaria, rash presenting the dyspnea on mild physical activity. He said these symptoms are due to the pizza containing tomatoes, chicken and the mushrooms. He sometimes remain normal after taking pizza of some brand. What is the cause of these symptoms? That is exercise induced food anaphylaxis. 130. The testosterone produced by which of the following? That is Charlie Leydig cells. Vitamin A in the retina is retinal. 132. Fiber for the pain and the pressure is beta fiber. Charlie. 133. Which one has a dual nerve supply but not reciprocal? That is the salivary gland. 134. The patient went to the prosthodontist. It didn't fit in the mouth, so he was referred to the doctor in examination. He has rigidity and the tremors. Which nucleus is likely affected in this case? That is substantia nigra. 135. Most significant increase creatinine in the end-stage renal disease. Charlie. Betel nut achieving associated with the submucosal fibrosis. 137. The mild mid-trimester erythropoiesis occurs in alpha liver. In ECG, complete ventricular depolarization occur in the ST segment. 139. Here on an end appearance on the X-ray, which is the next appropriate test for the diagnosis? That is HB lactophoresis alpha. A pregnant lady presented the obstructive jaundice features, which the following investigation will confirm the diagnosis? That is alpha GGT. 141. The furunculosis on the tip of the nose spread to the cavernous sinus by the ophthalmic vein alpha. 142. Virus causes cancer alteration in the proto-oncogenes alpha. 143. Which one has a similar reaction to the atropine? That is the scopolamine. Next 144. Your supervisor asks you to make a test which you can apply on the poor and the average socio-economical person. The test should have which characteristic? That is cost effectiveness. 145. The neoplasia microscopic finding in the inflammation is stroma inflammatory cells along with the vessels. 146. Nosocomial pneumonia causative agent is Staph aureus. There must be confusion between the beta and delta, but you have to go with Staph aureus. 147. Newborn, normal looking, but on examination doctor found mobile mass in the pelvis. After 3 days baby died. The cause would be the malunion of mesonephric and the ureteric. But 148. A 35-year-old male, their breast presented with acute sudden pain starting from the lower lumbar and radiating along the posterior aspect of left lower limb. Decreased sensation along the lateral border of the left foot, weakness of the left flexor hallucis longus and the diminished ankle jerk. This patient has compression of which of the following? That is the S1 root. 149. Neonate 32 weeks gestation in the nursery is prone to the hypoglycemia. 150. Middle rectal artery is the branch of internal iliac artery. 151. The primary gravida after RTA having decreased sensation below the abdomen, hypotension, bradycardia, worm extremities. The type of shock is, that is the neurogenic shock alpha. 152. The citrate is used in the bleeding because it is a chelator of calcium. 153. The patient with the microcytic hypochromic anemia presented with the spoon-shaped nail and target cells present. What is the diagnosis? That is IDA. 154. The boy with sudden increase in the high secondary sexual characteristics. Gonadotrophins are normal. The lesion of Leydig cell tumors. 155. The two athletes sitting in the room, one is professional, other is not. What is the finding in the former? That is increase in the carbon monoxide, in cardiac output. 156. Difference between the cerebellar and substantia nigra tremors, beta tremors on doing work. 157. Twin pregnancy with 2 ovum, which is correct? Charlie. Different chorion. So 158. Dots stand for directly observed treatment, short course. 159. Local anesthetic agents, maximum protein binding. 160. A patient has difficulty in climbing and during swimming can to crawl. Which muscle is damaged? that is the latissimus dorsi. 161, which cranial nerve has both afferent and efferent fibers, that is the facial. Last 162, a patient with enlarged hand and the feet with associated joint on MRI mass compressing optic chiasma was found. What can occur in this patient, that is the bitemporal heminopia. So thank you for watching my video. I have tried to make it as short as possible. Do subscribe my channel. Until my next video, take care. Allah Hafiz.